Okay, so we're moving on then with more diagnostic studies done in the cardiac cath lab. And so the next thing listed is the coronary angiogram. And um, really all I'm going to say about that for now is that the main reason we do a coronary angiogram is because of atherosclerosis. So that is a term that you need to know, which means the accumulation of plaque. And, atherosclerosis, the experts don't know exactly what causes it, why it accumulates, but I mean, it basically has to do with smoking, a sedentary lifestyle, eating fatty foods, just lifestyle in general. Of course, genetics plays a part in it also. But whatever the cause, it is an accumulation of plaque. And so this is a cross section of an artery. This could be any artery, but specifically we're talking about the coronary arteries. And so this is that demonstrating that fatty substance accumulating over time. And then as you can see, then it narrows the lumen or causes a stenosis. The other thing we deal with in the cath lab is what's called intimal hyperplasia. So intimal being the intima is the inner lining of a blood vessel. And then hyperplasia, it means overgrowth. So an overgrowth that occurs on the intima of a blood vessel. So what happens is we put a stent in, and the body detects that as a foreign object. While we're placing the stent, that actually, stretches the intima a little bit, or it sometimes, a little bit damages it, and that's part of it, so that the stent will adhere to the wall of the artery. Anyway, so when that stent is placed, the body detects that as a foreign object, and so it goes into fix mode. It tries to heal itself. It says, okay, wait, there's something here that's not normal. I need to fix it. And so it does an overgrowth in this stent area, which is called intimal hyperplasia or in-stent restenosis. The next item on the list is ventriculography, and so here is a left ventriculogram. And of course, in the cardiac cath lab, we see this, live on the screen, and so we're not used to seeing just static images of it. But this would be the left ventricle during diastole, so when the heart is at rest. And so again, here's all of this entire thing is the left ventricle. This chamber is the left ventricle, and then you can see the again the aortic valve area. Here is the aortic sinus area, or the valsalva sinuses, and then the ascending aorta. And then this would be the same ventricle, but during systole, during contraction, so when the heart is squeezing. So the ventriculogram demonstrates how well the left ventricle is functioning. It also can demonstrate mitral valve regurgitation. So here's a picture showing that, again, here's the left ventricle here. And so when the heart squeezes, the blood should be going through the aortic valve into the aorta. But if there is a faulty mitral valve, so here is the mitral valve. If there's a faulty mitral valve, then blood during systole will seep back up into that left atrium. And so that's what's called mitral valve regurgitation. And so the ventriculogram demonstrates that as well. The next item on the list is the internal mammary artery. And again, this picture is a good demonstration of, here is the left subclavian artery, and so then here is the internal mammary artery coming down. It travels inferiorly down the chest wall. And this diagram is actually demonstrating how this artery can be used as a bypass graft during open heart surgery. Okay, so let's pretend like there is a blockage. So this would be the right coronary artery. This is the left coronary artery. So let's pretend like there's a blockage right here. Well, then what they would do is take this internal mammary artery, the left one, cut it here from its original location, and then tie it here to distally of the blockage. And so in that way, blood will, or this artery will bypass the blockage and then tie into the artery, same artery, but just down further, so that the left coronary artery will get blood to it. Then of course here is the right internal mammary artery, and it also can be used as a bypass if needed. This is the next item is the saphenous vein graft, and so again here is demonstrating how the saphenous vein, which is a large vein of the thigh, can be harvested, which means they actually remove it. So there has to be a surgery done to remove this vein, and then as you can see, then they use that vein as a graft. So here now they've sewn in one end of the graft, or one end of that saphenous vein, into the arch of the aorta, and then they've sewn the other end of that vein into a distal segment of the right coronary artery. So in this example, we can assume that there was a blockage, like let's just say right here, of the right coronary artery. So as you can see, this tube will bypass that blockage and then go ahead and feed the rest of the right coronary artery in that way. Okay, the next item on the list is number 7, which is the femoral arteriogram. And so again, we got to consult the anatomy here. So here we've got the aorta. It bifurcates into the right and left common iliac arteries. Then it bifurcates into external and internal iliac arteries. This external iliac travels down, and as that artery crosses the femoral head, it then becomes the femoral artery. So right here is the femoral artery. Then that femoral artery then bifurcates just inferior to the femoral head. Then it bifurcates into the deep and superficial femoral artery. The main thing you need to know is that the femoral artery lies over the femoral head. So this area here is femoral artery. But I'll go through that again. So we've got aorta, bifurcates into right and left common iliacs. Then it bifurcates into internal and external iliac. So here, all of this is external iliac. Then as it crosses the femoral head, it becomes the femoral artery. And then just inferior to the femoral head, then it bifurcates again into, this is deep, and this is superficial femoral artery. The next thing is the radial artery, and that is important to us in the cardiac cath lab because of course it is a common access site, and so we'll be talking about that again more when we talk about the actual access procedure. Okay, the renal arteries, we kind of talked about these already, but this is something that is done in a cardiac cath lab from time to time. So those renal arteries, again, we've got the abdominal aorta here, and so the abdominal aorta has a ventral branch, which is the celiac artery. Then the next ventral branch is the superior mesenteric artery. Then you have the right renal and left renal. Those both go to the kidneys. Then you have an inferior mesenteric artery. And then from there, the aorta descends down, bifurcates into the right and left common iliacs, and then on this picture you can just barely see external and internal iliac, and that's as far down as you can see on this picture. The last item on the list is biopsy, and a biopsy is when a sample of tissue is taken in order for it to be examined more closely, and so that sometimes is done for heart transplant patients to demonstrate if the heart is being accepted or rejected by the body. And again, we'll talk more about that at a different time, but just understand, what a biopsy is and why it would occur in a cath lab. Okay, so lots of information covered today. Again, lots more anatomy. Seems like we've spent lots of weeks on anatomy, but it's very important to have a good foundation of anatomy before we start talking about different terms. Also, we just barely kind of touched upon these diagnostic studies. We'll go into each of these in more depth, but for now, you just need to know, what is a pulmonary angiogram and what would be the, most common reason why it would be done. That would be for a pulmonary embolism. You need to know the anatomy of the aorta, the anatomy of the coronary arteries. You need to know those terms that have been introduced, the atherosclerosis, intimal hyperplasia. You need to know the ventriculogram, what it looks like, the internal mammary artery, the saphenous vein graft. If someone were to ask you what is a saphenous vein graft, to have an idea of what that is. Femoral angiography, that more has to do with access, which we will talk more in depth about access. Same thing with radial angiography, that's how we access the arterial system. And then the renal arteries as well, needing to know, where those are located and that those are lateral branches. So I try to put all of that in Word format, and then if you follow along, with the pictures, and again, it takes a lot of practice, and so you have a really good foundation of the anatomy.